Hi, my name is Annie Martinie, and I'm a Senior Program Officer at the Danville Regional Foundation, which is a foundation that provides investments in health, education, workforce and economic development, and community capacity building. We're really looking to transform the region and make this be a place where everyone has the opportunity to thrive in Caswell County, North Carolina, Pittsylvania County, Virginia, and the city of Danville. So my main focus area is looking at the health and wellness of our region. And I have, along with many others, convened a group called the Health Collaborative that is a group of individuals and organizations that works across this region to improve health. And we're focusing on healthy eating, active living, access to healthcare, and healthy spaces. I live in Caswell County. I have been in North Carolina area for about 11 and a half years now. I grew up about an hour outside of Chicago, so I'm an Illinois girl originally, but have really enjoyed this part of the country. So I started at Danville Regional Foundation about 3.5 years ago and moved up to Caswell County at that time, and I live in the Samora in that northeast part of the county and really love it there. We were really looking for a place where we could enjoy that open space that we grew up in and have a little bit of land, have our dogs run free, grow vegetables, and really enjoy the nature and the beautiful landscape. We like agrarian parts of the country and have really enjoyed the space that we have in the Samora area in Caswell County. Through my job at Danville Regional Foundation and through a lot of the work I've done as a volunteer in the past, I've really been just amazingly impressed by the kindness and generosity of the folks in Caswell County. We came up here looking at the landscape and loving the way things look and feel in the county, but I have been truly impressed by how generous people have been. From the second day we were here, people dropping off baskets of locally grown food and homemade goods, and to the really strong focus on health and wellness that this county is taking. There was a health in all policies resolution that was adopted by the commissioners here in Caswell, the first in the region and really the first in a rural county that I know of. An amazing amount of effort around local food work and really helping local farmers and people get access to fresh food. New Parks and Rec master plan and other parks in the works. There's so much energy in this county, and I love being a part of it. And I feel that compared to some other places that I've lived, this is a county that really embraces people and makes you feel welcome and allows you to be part of the solution. And no matter where you've come from or how long you've lived here, it's really warm and welcoming to folks. And I think is really right on the cusp of really transforming this area and providing great opportunities for everybody who lives here. Caswell Family Medical Center is a great opportunity. It provides great access to healthcare in this area. And what I've noticed in the last 3 years of being here is that it's a rare organization that provides really patient-centered care, and there's a community health worker project that's going on in this region, and CFMC has really embraced that project and is really trying to think outside of the box on how to get folks access to care, and not just access to a primary care provider and other health services, but overcome a lot of those big barriers that folks have to accessing healthcare around social issues or economic issues. And in my experience, CFMC has been a huge partner in trying to develop really innovative solutions for some of the challenges. So there is work still yet to be accomplished in this county, but a lot of people are around the table and really helping to make that happen. I think that the key will be for us to continue to work collaboratively and try to make all these connections in the work that we're doing and work as a county and as a unit to really create change and not just improve health, but we know that's really well connected with the economic development in this region, workforce development, and the education of our young people. We know that healthy young people are better learners, healthier adults are more productive and are able to really contribute to the county that we live in. So I think it's important for all of us to work across sectors as we move forward, and I think Caswell is going to accomplish some really amazing things in the short term and definitely in the long term as well. My name is Annie Martinie, and I care about Caswell.